Hello there. Thank you so much for joining us tonight. This is a really, really special night for us. Jonathan, Johanna, Ross, and their team are very, very important people to us. I'm going to read from my little prepared script here. I'll keep this very brief. Again, thank you all for coming out tonight. We have a wonderful experience planned for you. I'll try to be brief, as I am the last person on earth that should be discussing food and nutrition. I was raised in the suburbs of New Jersey in the 1970s, and my parents' nutritional coaches were Madison Avenue advertising agencies that touted the nutritional value of Pop-Tarts and their 7 minerals and vitamins. The four basic food groups in my family were cereal, pizza, French fries, and candy. So this is an initiative that is very close to my heart, as I've learned over the years how to eat better and take care of myself and my family. My name is Mike Criscolo. I'm the owner and chief bottle washer here at Holt Environments. We are celebrating 48 years in business here. We're locally owned and operated. We have 55 teammates that are based here in North Carolina, and we help companies build their brands predominantly by creating visually and compelling environments that help companies tell the story of their agencies or their companies or organizations. So the first story I'm going to tell you is our connection to Jonathan, Johanna, and Ross and their teammates. So the reason why you're here in this building is Jonathan joined our company in 2015 by way of an old-fashioned job fair. So we met Jonathan, and for those of you who know Jonathan, he's here on stage, there's a light that emanates from him. Immediately we knew that he had the core values that we look for in an employee: integrity, strength of character, great talent. He's an incredibly skilled graphic designer. Everything that you see in here was prepared by he and his staff. He's incredibly creative in a way of being a problem solver. At our company, we build custom things. Everything we do is from scratch, so we have to have incredibly talented problem solvers. I mean, he is that. He learns to cut through the clutter and get to the heart of what needs to be done. He's highly empathetic, as we all know, or for those of you that don't know him, you will realize he's an incredible person. He's full of pride and passion. Soon after joining our company, Jonathan began to disclose his real passion, his hidden passion to us, which was to shine a light on food insecurity and poor nutrition among schools and people of poor socioeconomic backgrounds here in North Carolina. But more importantly, he was determined to fix it. What we didn't realize is initially was the intensity of this passion. One of his friends and coworkers commented to me this morning, "I'm so envious of Jonathan. It must be great to feel so compelled to do something so good." With Johanna, a tour de force in operations, and Ross, a travel nurse and chef trained at the Pennsylvania Institute of Culinary Arts, joining him in this passion, Kitchenology was born. In 2020, Jonathan left our company and focused completely on Kitchenology. We as a company have continued to support Kitchenology, which brings us here to hosting this fundraiser tonight. Over the course of the evening, we hope to have you gain a greater understanding of Kitchenology, why it's such a wonderful concept, and how you can be a part of this remarkable nonprofit. Without further delay, I would like you to meet our first speaker, who gives me great pride and happiness to introduce Jonathan Seeley.
Good evening, everyone. Thank you for joining us. We're really excited to be here tonight, and I cannot tell you how gracious I am for you all joining us tonight. Some of you in this room may know my story, but many may not. Serving our community and working to combat food insecurity is very close to my heart. Growing up with a single mother of 6 children, I know firsthand what food insecurity is like. However, through our community, churches, local fire departments, and a number of other organizations, many like the organizations that are in this room tonight, we were offered a hand up. My mother was able to focus on her education and earn a degree as a physician assistant from Hardeman University. Not only did she earn her degree, but she was one of 4 selected for who's who of American colleges and universities from her class. Through community, education, and empowerment, we were able to pull out of poverty. The development of Homegrown Heroes nonprofit was to help provide a solution to food insecurity by providing education through teaching gardens. When I enrolled at UNCG, pursuing a degree in nutrition, the passion evolved as I realized the importance of food as medicine. Understanding how many people are impacted by diet-related chronic disease. Last year, we received a grant from the Earl and Catherine Condon Family Foundation, allowing us to open the doors to Kitchenology, our nonprofit teaching kitchen. It was a year of discovery and growth. We were able to work with nutrition students, families, farmers markets, and various other organizations. We truly fed food education forward at various levels of work to empower our community. Our goal is to have a lasting impact by training individuals that will enter the workforce and continue to share their knowledge and skill sets acquired. We understand the importance of providing education and resources to our community and the importance of working at the farm level as well as the clinical level, as you'll hear from our keynote speakers tonight. North Carolina is strong in resources. We have the best universities, healthcare facilities, and ranked 10 in the nation for agriculture. We have the resources right here. Through collaboration, we have the ability to truly make an impact. We are very grateful to join Growing High Point and the Greater High Point Food Alliance recently to discuss with Second Harvest Food Bank ways our organizations are impacting our community. We are excited to be sourcing nutrient-dense produce and vegetables from Growing High Point and working with Grodega on an RX food prescription pilot program, made possible by a grant received by Greater High Point Food Alliance. We are stronger together. Our organizations is on the cusp of advancing our programs and scaling our services. Our executive chef, Ross Boland, is also a registered nurse who has a very unique ability to bridge the gap between food and the healthcare system. We are honored that Carolina Core Wellness will sponsor Ross to enroll in the Certified Culinary Medicine Specialist program, which involves hands-on training and is a 60-hour credit course for healthcare professionals. We are thrilled that this training will take place at Tulane University, where the culinary medicine program originated. Kim Correa, our team's registered dietitian, has also completed a 16-week culinary medicine course at UNCG. Kim served as a mental health counselor in the U.S. Army for 4 years and is currently working as a clinical dietitian at a VA health clinic. We have a multifaceted team that brings a number of skill sets to our organization. We even have a team member from Florida that works remotely and travels with us to be at our events. I am so grateful for each and every one of you for volunteering countless hours in your time, whether it may be in the kitchen, the garden, or community outreach. We are committed to make a difference. Our commitment to make a difference is what drives our organization. We have an incredible opportunity to move to a residential teaching kitchen in the heart of High Point. The new kitchen would be a dedicated space to focus on education, expand our program, and allow us to make direct connection to the surrounding community. The space would be outfitted with multiple stations for hands-on training and a classroom designed for instruction for all ages and culinary skill sets. John Mardoon with Cohab Space has been working with us for several months to help develop this space and has pledged to offer a 50% in-kind donation for our lease. Through our partnership with Short Street Group, we are afforded the opportunity to expand our programming for culinary and healthcare students in a professional teaching environment. Their commercial production kitchen space provides the necessary infrastructure to scale our services and seek sustainability with our Catering with a Cause and meal prep programs. George Street Group has pledged to provide us with a subsidized membership that allow us to fulfill our meal prep program. Holt Environments has shown us unwavering support of our initiatives through the years. They have provided us tremendous resources, assisting us with branding of our space, designing renderings, and provided our graphics. Holt has also dedicated numerous hours conducting discovery meetings and providing mentorship throughout the process of growing our nonprofit. They have graciously welcomed us tonight, sharing this beautiful space and along with equipment, and have fully sponsored this event. We are incredibly grateful for their generous in-kind donations. We cannot fully express what these partnerships means to us. Our team is very thankful for your investment in our organization and for seeing the value of what we bring to our community. We look forward to talking one-on-one with each of you in this room tonight on how you can be a part of our project and support our ongoing efforts. I cannot thank you enough for being here tonight. Thank you.
Thank you, Jonathan. I'm going to introduce Megan Ogilvie. Megan is the Executive Director of the Earl and Catherine Congdon Foundation, Family Foundation. Megan.
Assistant Technical Director.
Yeah. The Congdon Foundation invests in organizations within the greater High Point area and beyond that promotes improved quality of life by reducing barriers to opportunity. The Foundation's board empowers Megan to fully immerse herself in the High Point community so she is able to create and maintain strong relationships with nonprofit organizations and community leaders throughout the region in order to understand and articulate the evolving needs of the city and region. So welcome, thank you for being here, and over to you.
Well, not a very good technical assistant apparently. Hey everybody, thanks for being here tonight. So I'm the Executive Director of the Earl and Catherine Congdon Family Foundation. We are a mostly place-based private family foundation. The majority of our work is here in the greater High Point area. And we have 3 areas of focus. So we love to invest in nonprofit organizations that are doing great work, and we have a lot of really amazing organizations. So we have 3 areas of focus where we hope to have a lasting impact through these partnerships. The first one is education, so increasing quality of and access to education. The second is critical community needs, addressing those and helping overcome barriers to opportunity through those critical needs. And then the third is economic development for revitalization and stabilization. And what was really interesting, Jonathan and I crossed paths actually, 6 or 7 years ago. He had an idea about a mobile food truck when I was working at the Chamber of Commerce in High Point. And it was interesting when we met back in late 2020, he was talking about the Kitchenology teaching kitchen. And it's really a cross-section of 3 of our areas of focus. It's education with this teaching kitchen, is addressing critical community needs because they believe that you can use good food, as a tool to help increase health outcomes. And then of course 3, economic development. If you're giving people the opportunity to better their health, they're also able to hold a good job. And then also with the ecosystem of our food environment, so partnering with Greater High Point Food Alliance, with all of our, with Growing High Point, Bodega. So as you heard from Jonathan, the key to their success is partnerships. And one of the questions we ask on our application is, who are you partnering with to get your work done, and how are you collaborating in a way that is adding to your capacity? And so one of the things that's impressed me the most about Kitchenology is their ability to collaborate and to be strategic with their partnerships. So they have taken a small grant and really have done an amazing work with what little time they've had so far. So I'm very excited to see what you guys do in the future, and we are honored to be a part of this work. So thank you very much.
Our next speaker is Dr. Catherine Leon. She's a PhD and professor at North Carolina A&T University. She's a Kellogg Distinguished Professor and Director of Science and Environmental Farming Systems. So she's actually a farmer, as I've learned tonight, which is really cool. Dr. Leon is an award-winning scholar who has developed a community entrepreneurship curriculum and is the service and experiential learning programs that integrate science-based research and innovative teaching into outreach. She is an expert in multifunctional farm research, food insecurity issues, food system and network analysis, and community entrepreneurship. So welcome to the stage. Thank you. We look forward to your speech.
Thank you for having me. I'm gonna get my slides ready. Is there something I can flip the slides?
Yes, ma'am. Go through it. Just press that button.
This is forward.
Yes, ma'am.
There's no backward.
There's backwards. One.
Sounds like our civilization progress, only moving forward, no backward. It's cool. And it's super excited to be here. I am with North Carolina A&T. We'll make sure that's correct. My dean will not be very happy. But that's just for fun story. But I'm here to share with you why it is important to support an organization like Kitchenology and the people all work in the local food perspective. That's a part of my research, of course. I'm one of the few scholars in the country. Are you recording this? Gotta make sure I acknowledge all the people funded my research information. I gotta put this in the tape. So I've received the funding from U.S. Department of Agriculture, North Carolina Department of Agriculture and Consumer Services, National Science Foundation, Department of Energy, Kellogg Foundation Endowment, that's where the title of the whole thing comes from. So, and a whole lot of other stuff. So what I'm going to present is about the base. Why this is important, how things come about, why we are actually moving a little bit backward in food and health, but how we can make a change and tailor a different direction, all right? Food for medicine is not a new concept. You all know that. You know, if we eat well, treat our body well, we should be fine. But what went wrong? All right, let's look at the situation and why this kind of organization is important for us to support. I've been at A&T for 7 years now, but let me show you a little bit about myself. So I won't fall, I'll just stay right here. I was born and raised in Taiwan, came to this country to go to school. I graduated from Purdue University. My degree is actually in agricultural economics. So I'm an economist. And then after that, I moved to Nebraska, Panhandle Research Extension Center. Anybody knows Nebraska? Raise your hand. Anybody knows where Scottsbluff is in Nebraska? All right, I don't think so. If you take out the US map, Highway 80, you just go all the way following Highway 80 until you hit that big mountain. No, what's the name of that mountain? Rocky Mountain, yeah. Until you hit, somebody has to know this. Until you hit that Rocky Mountain, the gate to the western part of the country, right? That's Gold Rush, Oregon Trail, all those kind of things. That's where Scottsbluff is. Scottsbluff has one of the best research extension center by University of Nebraska, all interdisciplinary scholars. I was a new PhD, started my career not as an economist. I was very well educated and very fortunate to work with farmers, migrant workers, buffalo herd, prairie dogs, and all these other things you don't want to know. Right? That's how I got educated, actually after I graduated. So when people say I have a PhD, that PhD is just a seal. It doesn't mean a thing, doesn't bring me any money, fortune, reputation, whatsoever. But the knowledge I gained through my work experience will keep me a long time around, okay? And then after Nebraska, I found a real job as a faculty with the University of Vermont. So that's where I built my career, 19 years. Whatever you call this a thing, I ran into a midlife crisis, basically. When I turned 50, I asked myself the question, is this it? At the University of Vermont as a full professor? I started the entrepreneurship program, I started a lot of food system research, I do agritourism as one of the pioneers in the country, and then you make sure you record this. But I had a feeling something was missing, but I couldn't tell. So the A&T opportunity came up, my colleague recruited me, I said, you go ahead, try it. I said, you think I'm qualified to do that? Why not? I talked to my daughter, that's the only relative I have in this country. I'm a single mom raising my child, not a problem at all. She graduated from MIT, by the way, so. I have to do something right. But the thing is, I came to North Carolina A&T for one reason only, and I want to make a difference using my knowledge and my skills just to get things out there. If I'm going to fight the same issue with the same people over time, why not change an institution? You know, at least those people don't know me well enough. Yeah. So I came very happy, but since young, that's Taiwan, by the way, a little island. You know, not as big as it's about even 1/3 of North Carolina, if you imagine that. But we have 25 million people. Okay, we all piled up on each other, basically. Now, but since I was young, I was a really picky eater. I lied about being allergic to all the fresh produce, and then my mom actually believed. I faked, and I was going to faint after I ate any vegetable. But something kept me alive. Eggplant, bitter melon. I will show more later. Those two actually kept me alive for so long. And then, I'm also allergic to some of the antibiotics. So if I get sick, I'm in big dude. Which happened. You know, the doctor prescribed antibiotic to me in 3 days. I came out like all the rash, like a chicken pox, and in between all the smallpox and all these things. The doctor said, what's wrong with you? I said, I'm allergic to it. Okay? So vegetable it is. How this works. A lot of issues we are aware of, we know. Your organization knows, Kitchenology knows, you all know. But we just don't talk about it. What's the problem of our food system today? First of all, there's a huge market gap, a lot of information message, product, value added, commercial driven. Think about it. Now, I didn't say right or wrong. Make sure we record this too. Now, there's no right or wrong in this scenario, but each one of us can make a decision, all right? The commercial, the advertising, the promotion stuff on TV, kids sit there and watch TV 8 hours a day, you know what they're gonna eat. Am I right? When you take them to go to the grocery store, they're gonna pull you to that aisle because they remember what they saw, okay? That nowadays, the device, social media, all these other things, of course. Another issue, financial thing. Since the very beginning of the economic stuff even started being a theory, we focus on wealth creation. Am I right? Productivity, huge amount, okay? Because we have to feed people, there's nothing wrong about that. The population growth is scary now. Somebody has to figure out a way to feed all the people. But what do we feed those people? That's an issue. Think about it. Have you heard about people saying it would be nice to have some of the, like the basic non-processed food in original form? Would be better for you instead of taking in all other edited materials? How many of you go to market and you actually read the label for what you're buying? All right, some. Now, how many of you go to restaurant when you order a meal, you actually read the labels, talk to the chef, what did you put in here? No. I talk to the chef all the time. One time the chef came out and said, who wants to know about this stuff? I said, I want to know where your lobster came from. And I was in Calgary, Canada, visiting my parents. My parents brought me 2 red lobster. They said, oh, you know, that's good local food. I said, Ma, are you serious? But anyway, that's a treat. So we went to Red Lobster. I asked the chef where the lobster came from. I was expecting to hear Vancouver, huh? Well, guess where the lobster came from? The chef was so proud. The lobster arrived in the air from Maine this morning. The lobster flew all the way across the country from Maine, where I live. Remember where I lived before? Vermont? $4.99 I can get a lobster. My mom treated me lobster in Kelvin for 35 bucks. Okay? Out of the 35 bucks, guess what I paid? I paid the gasoline. I paid all the time. I paid the aircraft. I paid everything else except for that food itself. Think about it. Okay? Now, customers, we got to help people to understand what is going on so we can make an educated choice. There's nothing wrong about eating candy bar. Didn't Michael you say you had candy bar stuff? There's nothing wrong about that, by the way. Go ahead, feel free to eat, okay? That's his choice. I eat gummy bear too when I'm real hungry. There's nothing wrong about that, even though I know that's no good, no good. But the gummy is so cute. Okay? But it's our choices. We just need to have proper information. And then finally, the cost. We rarely think about is the cost from production to transportation, supply chain, handling, labeling, everything, plus the waste. Do you eat all the food you serve every day, every meal? You know how much food we throw away? How much of the food never even get to our plate, wasted at a farm level? They're ugly, too big, too small, doesn't look right, discolored, got a little bug hole in there. And we dump them, but they're just as good. Okay, so these are all knowledge-based information we can think about. So there are solutions. Connectivity, I think a lot of you mentioned the connection with people, connecting with organizations, connecting with the chefs. I love chefs. All right? Because the chefs make a decision to buy, what to cook, how to cook, and then educate customers. And then help people to understand the connection from the soil. By the way, don't ever call dirt again, okay? From soil, the microbe, the living thing living in there. I always tell my students, soil is alive. Good soil produces good food for people's health. It comes all the way at that level, okay, not in supermarket. I asked my students, do you know where eggs came from? Supermarket. I said, you serious? Yeah, my mom said so. I said, okay, go home, ask your mom, how did they get the eggs into the supermarket? The next day they came back with the cutest answer. They actually asked the mom. They said, Doc, mom told me, there's a bunch of the chicken poops all behind that supermarket right there. I said, you go around to Harris Teeter, see if you see any chicken behind it. You know? The parents, grandparents, great-grandparents' knowledge gets lost. Does that make sense? So it's our responsibility, no matter how old you are, how old your children, your grandchildren are, please give them the right knowledge where chicken and the eggs come from, all right? And then finally, if we do it right, the whole system could be more efficient. Life will be so much happier. I respect pharmaceutical companies. Make this record clear too. Right. We do need a pharmaceutical company to deal with the treatment, the issue, to help us reduce pain, that sort of thing. But there is another step ahead of that. Is to treat our body well, so you don't need to see pharmaceutical companies. Okay? That's two different stages. All right? Even for pharmaceutical companies, a lot of them are doing green treatment, natural remedy now. They're trying too. Not making much money. Not yet. All right? But we got to do more on that. I told you, and I think Michael said, I'm a farmer. I am a working farmer. This is our research farm in Goldsboro, small farm unit. It's a part of a cherry research farm, about 2,500 acres. The largest, I believe, in North Carolina, maybe one of the largest in the country. I run a 30-acre research farm, organic. We have a 15-acre certified organic, a 15-acre non-certified organic, but we practice organic. No commercial anything, okay? Most of the time, I don't even need a fertilizer. I use cover crop to nurture the soil. You see, it doesn't look very pretty, but I tell you, it's a farm, okay? When people come to visit, they say, Doc, this is just a farm. I said, what do you expect? My flyer says farm tour. I didn't say Taj Mahal, all right? And there are people walking there in high heels. I said, what are you wearing high heels? Well, I didn't know what a farm looks like. That is how bad sometimes things get. And I'm talking about nowadays, not 10 years ago, okay? I work with these people all the time. Put it on your calendar if you come to visit us. We have a farm field day in the summertime, July 12th, July 13th. Come see us. I cook, by the way. For my training, I do a whole series of training. I do research about crops using conservation practices from a farm level. Make sure the farmers understand how to save money. And then we do training education on site. And then we help people to understand the circular economy. Save money, save time, save waste. Or reuse the waste back to the natural component. Finally, I do cooking demonstrations. I cook. I tell them how to eat stuff, what that thing is. I have a prop. Now, by the way, I sound like a duck today. Okay? So just bear with me. I usually have very beautiful voices. Yeah. Anybody guess what this is?
Pomelo.
Pomelo, yeah, I already ate a half, as you can see, all right? This is my medicine for my sore throat. My sinus problem, this temperature is driving me nuts, and all these other things in the air, crazy stuff. I don't go to take a Benadryl. Forget about it. Tylenol, no. This is it. The whole thing is vitamin C. Works really well. The peel, the wrap, is actually edible too. Now, don't put this on the table, because you actually have to cook it. After I take the peel off, I boil them in the water with some honey, lemon, and the ginger. It's a natural tea. So this whole fruit is edible. Okay? You see this white featherish stuff? Most of people pick them, and I said, "Why are you picking them? That's the best thing to clean your guts. Eat it." Doc, how do you chew this? I said, "You just swallow it. Who told you to chew?" What? No, it's a yucky. I said, "All right. Your option is either this or go to see a doctor when you're sick. You want to do this, which is about $3, no more than $5 each. You eat one of this for 3 days, you go to bed just as good as new. Or you make an appointment with your doctor, wait for 10 days or 2 weeks, and then by that time you're covered in. All right? This is my remedy. Finally, show you some pictures about what we grow. Purple bean, for fuzzy gourds, specialty kale. Everything I grow, organic certified, not currently in the market in North Carolina. The goal is for me to help farmers to push this out to consumers. We teach people what to eat first, and then people will say, "Doc, where can I go to buy it?" Then I nudge farmers, hey, there are people buying this stuff. Okay? But if you know there are Asian markets all over the place, you go there to look at what they have. They have these things. Now, where did they get their produce from, you think? Is it from North Carolina? It's a quiz for you guys. We'll find out next time. Most of these ethnic vegetables came from overseas. Now, think about that footprint. You talk about carbon emission, all this stuff. Why can't we just grow it in our own communities? North Carolina ranks the top 5, one of the best agricultural states in the whole country. We can do it. We just need to know how. With organizations like that, they help to promote health. We help to promote farmers. Everybody in the audience, you just help us to eat. All right? Finally, that's a bitter melon. See how big my bitter melons are? When I talk about bitter melon is the best natural remedy. If you dare to eat a raw bitter melon, that thing can scare cancer away. And I'm not making it up. There are actually research about it. It significantly reduce cancerous cells in a very short time period. And then the other thing I'm holding is the so-called okra squash. You will see, these are not uncommon. These are all available in Asian market. They're not from North Carolina yet. My dream one day is when I retire, who knows when. Maybe one day until I lose my voice, but I will still walk around, by the way. I want to see everywhere have North Carolina grown as sign. Every market I can go, I can see, and the people actually know what it is and how to eat it. I have a handout. We have a really simple cookbook. Jonathan, if you want to show one. The cookbook is available for you. Have about 50 different kinds of specialty vegetables we grow with the recipe, natural benefit in there. I have today's PowerPoint information. Then I have the small farm unit information about what we grow. So after the program, feel free to hang around, help them out, pick up some copies. I have no intention to bring them back. And by the way, do not waste paper. Okay? Thank you very much.
Without further ado, I'm going to introduce our next speaker, Dr. Joseph Skelton from Wake Forest University School of Medicine. Dr. Skelton is a professor of pediatrics and epidemiology and prevention. He serves as director of the Brenner Families in Training Program, an interdisciplinary pediatric obesity treatment, prevention, research, and education program, and as Associate Director of the Program in Community Engagement. He is the Director of the Center of Prevention Science in Children and Family Health and serves as the Editor-in-Chief of the Journal of Childhood Obesity. He is a board-certified pediatric and obesity medicine.
Does that sound okay?
Yes.
All right. I'm going to push start on the timer because they told me that I don't want to go over, and I was raised Southern Baptist, and so it's kind of like it's 11:45 on a Sunday, and it's only going to be a 15-minute sermon. No, it's never going to be just a 15-minute sermon, but I'm going to try to stick to that. And that was a wonderful talk. I really get in sort of the circle of life. My grandfather, all my family, they were farmers in Northeast Tennessee. Small, almost sustenance farmers there. My grandfather put 4 of his 5 kids through college. My dad was an agricultural economics major in college, kind of very similar to what you taught. All of us went to college. He forbid any of us go into farming, so my dad kind of, I think, is rolling his eyes in heaven right now because next week I'm teaching med students how to do some plant-based protein cooking. And it reminds me next week, because I teach a barbecue tofu recipe. And it reminds me that my grandfather was a TVA demonstration farmer. So he worked with professors like you of how to do better farming techniques. And he came home one day and told my aunt, my father was a baby at this time, and he says, because they grew soybeans to feed to the cattle. And he came home one day and he said, do you know one day they said, people are going to eat soybeans? And I think about that every time I cook some tofu with these students. So I'm going to talk about a little bit of exactly what Jonathan was talking about, and that's sort of the field of culinary medicine. So you have to forgive me, this is a very sort of medical talk with that. And what it is, it's really a way about how to teach about nutrition, but through cooking, because that is the way that we get nutrition into our bodies. Overall, it's through cooking, whether you're doing the cooking or whether someone else is doing the cooking, but we get nutrition into our bodies through cooking. So we like to call it applied nutrition. And it's a way, it was originally started at a med school in New York, and now it's mainly headquartered in Tulane. But it's a unique way to teach about nutrition, to apply nutrition. It's not necessarily teaching nutrition. There's a whole degree program dedicated to that, so we don't get down into calories and things like that. It's not necessarily we teach cooking, but it's not culinary arts. That's a whole different educational program, which Ross will tell you about. And it's not one specific dietary philosophy. So a lot of what we teach, you wouldn't necessarily would say is always going to be healthy cooking. We sort of have a philosophy that to learn how to cook healthy, you first have to learn how to cook. And so oftentimes you have to learn, it's way beyond just the idea of sort of healthy cooking is what culinary medicine is. But it is a field that sort of mixes the science of cooking with the science of nutrition. So even back in 1985, they were saying that you needed 25 hours of direct teaching about nutrition. In 1989, they said that you actually upped that to 37 hours. Then State University of New York, they came out with one of the first culinary medicine programs. I'm going to appear, so I don't turn my back on you guys. And then Harvard, where unfortunately I had to go out to Napa Valley. Actually, that's where they were teaching the culinary medicine course out there, so I was forced to go out there to train in that. They had the program out there. And then Tulane is the one that really sort of took it on, which you heard about earlier in 2013, that really made it part of their core curriculum there, is about teaching culinary medicine to all their med students. It also came, and this is what we've really discovered, is when you start to teach students about that, and you teach all the complexities about food and food insecurity and nutrition, it really inspires them to do more than just talk to their patients about nutrition. They get really involved with addressing issues such as food insecurity that Jonathan was talking about, and they really get involved. We know that over half of the students that participate in our program end up volunteering in programs in the community. And that's what Tulane's program is doing. And so they have med students all across New Orleans actually teaching cooking classes in the community. So in our program, we started a program that was more broadly focused on wellness that we called Fit Living. It was a two-year longitudinal program that included things about sleep, stress management, fitness, exercise, nutrition. We published it in the American Journal of Lifestyle Medicine. But what we found is what students really enjoyed and what they really wanted to know about is they really wanted to know about cooking. They really wanted to know about food and cooking and nutrition. All the rest of the stuff they thought was great, and they felt like they got aspects of that within their medical education, but what they really wanted to know more about was cooking. And so we started our program that was called The Doctor is in the Kitchen, which is a 5-part cooking series. Probably about a quarter of the students in the med school actually participate in that. We try to really broaden it, not just to be about cooking, not just to be about nutrition, but to focus on cultural aspects of food. One of the first activities that we do is have people share what is a food memory from your childhood, which is just fantastic. One of the most amazing stories recently was a student that has a Persian background, but her dad grew up in Kenya and her mom grew up in Zanzibar, and she was raised in Brooklyn. And so her food background was just absolutely amazing. And so just these sort of the stories and what food means to people is always so meaningful. And so it's gotten to be a very successful program. And so that has actually led to a program that's getting ready to start that actually Ross is going to participate in, which is a 4th-year culinary medicine elective where you really dive deep and you go deeper into all these subjects, from the cultural aspects to the food insecurity aspects and to then actually the hands-on culinary aspects of it. But anyway, that's a little bit of what we're doing up there. It's never going to be enough. We could always do more. So why do we need that? And so the paper up there is a study that we did where we surveyed all the first-year medical students at Wake Forest on their background in nutrition. And what we surveyed them on is with their nutrition knowledge, what educational background they had with nutrition. And again, these are doctors. These are doctors that when they get out, they can be paid to do nutritional counseling with their patients. So we did interviews with them. We interviewed almost every single med student, 145 first-year medical students at Wake Forest. We interviewed 142 of them. What we found is they barely had better nutrition knowledge than the general population. So we did a survey that they've done across all the nation. They barely had more nutrition knowledge than your average American. They had very little to no formal nutrition education. A few students had a nutrition, like there was one student that had a degree in nutrition. A few students had a class or two in college, but literally they had no nutrition knowledge coming in. What little nutrition knowledge they had was just self-study, which we all know what that means. Google University. They had very little knowledge in nutrition or in cooking and food preparation. What little they had, they typically got from their parents. They were actually, their nutrition habits were probably on par with what most Americans were cooking, as well as things like fruits and vegetables and stuff like that. And really, like I said, most of what they got was really outside the classroom. It's kind of depressing. So we're graduating doctors with really kind of basically very average nutrition knowledge, and we need to do a lot better than that. So what about the rest of the country? Really, overall, the rest of medical schools are really not doing that much better. Only 1/4 of medical schools in the United States have a dedicated nutrition course. There's an average of about 20 hours of contact time with nutrition, and I would say that's probably exaggerated. I'd say it's probably rounded up. That's probably including time that someone is sitting with me in clinic, listening to me talk to a patient, and they kind of record that as an hour of contact, nutrition contact. My college, I went to University of Tennessee, Memphis. I had a 2-hour nutrition course that was taught by a biochemist. So that was not what I would call applied nutrition knowledge. Less than a third of first-year doctors outside of medical school feel that they have enough training in nutrition, and people graduating their training, only about half of them feel that they are actually well trained with that. So we need more of this. And not just, I'm just talking about doctors. I mean, what Jonathan was talking about, all medical, because who actually spends more time in the medical field? Who actually spends more time with patients, with you all? It's not the doctors. It's the nurses, it's the dietitians, it's the counselors, it's the nursing assistants, it's all the other people within the medical field that need this nutrition knowledge that we can pass on to the people that we provide care for. Really quick slide with this, it's also just getting worse. And even though we know this, we're calling attention to this. Chapel Hill, every couple of years, I'm going through a rough time right now. My son just toured Chapel Hill, and I think he wants to go there. So, if we could all kind of bow our heads for a minute. I've been praying against that for a while. But anyway, we'll move on past that. They do a survey every couple of years, and it's actually just getting worse every year, that the amount of time that our medical schools, and I'm just saying medical schools because that's my world. I think almost all medical professional schools, whether it's nursing, pharmacy, my wife's a pharmacist, I think it's going down almost every year of how much time we spend training people in nutrition, much less the practical nutrition that we're talking about when it comes to culinary medicine. So we really need this. In my world, I think we need a lot more of this. We need it in both the personal and professional. When we talk to residents, we talk to medical students, they say they need it. These are busy people that work long hours, and they're not taking care of themselves. They're not feeding themselves enough fruits and vegetables. They need more hands-on. And we don't need to do it in that traditional way where we're giving more and more lectures. So think about it this way. I got a lecture on how to take out someone's, I'm sorry if you got a queasy stomach, of how to take someone's appendix out. Well, I'm sorry, you don't want me taking your appendix out just because I read a couple of books about how to take out an appendix. It's kind of the same thing. Someone that reads a lot about nutrition, especially someone that reads about it from Dr. Google, I don't want them counseling me on that because I don't know where they got that information. So the old adage in medical education was see one, do one, teach one. And that's what we need to do. We need to get people practical experience in how to feed themselves, and feed themselves in a way that will nourish them, and nourish them in a way that they can live the fullest life that they can. So that's why we need it. And especially with what I do as a pediatrician, as always, we need to think about the kids. We do know that when children are involved in home meal preparation, that they tend to have healthier diets. They tend to eat more vegetables when the more meals that they cook at home, and also the more meals that they're prepared with. I've converted, and I'm sure this goes, Jonathan will also tell you, I've converted a lot of kids to Brussels sprouts. Just by, whoa, man, that was, amen, that's a Sunday in church again. Convert a lot of kids to that. Wow, I really do clap in church. I've not gotten that before. But it really is true. And actually the research really supports that. The more they get hands-on with stuff, the more they're actually likely, they will eat a bitter melon, I imagine, if you get them involved in preparing it. Mm-hmm. And we know that the more meals that we prepare at home, the healthier diet that we tend to have. And that tends to go on to a whole lot more. And it's also when it comes, again, I'm sorry for being very focused on my world, that a lot with physicians, the more that we practice healthy living, the more likely and the more comfortable we are with talking to our patients about it. And it goes with a lot of other things when it comes to exercise, wearing seat belts, and also it goes with nutrition. So the impact of diet on health, I want to fly past that. I think we know a lot about this. And to actually summarize that, the bulk of deaths that occur in the United States, there is going to be some link of those diseases to diet. Now, that's not saying diet is the sole cause of that. There's a whole lot else that goes into that, especially when you talk about other social drivers of health, but diet is a big part of that. I'm not going to talk about one specific diet. We could argue about that all day. Don't make me bring Twitter into this. It's going to get that much more complicated. But overall, there are some essential truths that we know. Diet research, nutrition research is extremely complex, mainly because what we know, people lie a lot. People lie about sugar surveys a lot. But there are some truths that we know. That refined grains, processed meats, unprocessed red meat, sugar-sweetened beverages, sugar on the whole, trans fat, which is kind of thing that passing sodium. We do know that there's some truths of things that we need to consume less are going to be bad for us. Overall, a healthy diet is going to decrease risk of these main diseases. One of the biggest things aside from that, what's getting in the way of that is we're eating more meals out and less meals at home. Now, first thing I'll say, I love restaurants. I love eating out. I support our local restaurant industry. I feel like I was on a one-person mission to keep restaurants open in Winston-Salem during the pandemic. But unfortunately, a lot of these restaurants that are going up are oftentimes restaurants that, they're chain restaurants, they're always oftentimes not going to be the restaurants that are going to be the best for us. And I think what kind of drives me crazy, and this is what Dr. Liang was really speaking to, is where's a lot of this money going to, which is what we want people to eat as far as the balanced plate, versus what is our government sort of supporting? What are the subsidies going towards? Corn and other grains. Now, what's most of the money with corn going towards? What's most of corn going to? Not the corn on the cob. It's going towards corn oil, corn syrup, and ethanol, typically. And so there is obviously a larger work that she obviously is very aware of that we need to change with that, that's sort of working against us. But one thing we do need to think about is how can we get people trying to get more of these meals at home, spending more time together, eating at home. And this is actually the percentage of people in these countries that have obesity and how much time that they spend cooking. And as you go down that x-axis, those are the countries that spend more time cooking. So what we see is that in the United States and United Kingdom, and this is a little bit of an old graph, we spend the least amount of time cooking as well as having the highest rates of obesity. There's lots of other things that go into that, but I think it's needless to say is likely we do a lot better if we did spend more time cooking. Obviously, a very old quote, let food be thy medicine and medicine be thy food. Another reason that we need to do a better job on the whole, educating everyone about food, nutrition, and cooking is it leaves us very open to a lot of fad diets going out there. Now, there is a lot of diets out there that have a very distinct and direct link from the food to the health. You know, the ketogenic diet helping with epilepsy. Mediterranean diet, I can't remember how many years in a row, it's the top diet as far as preventing cardiovascular disease and cancer. A lot of, the DASH diet and hypertension. There's a lot of specific diets linked to specific disease processes. Diet mental health is getting a lot of interest as far as eating a healthier diet and the effect that it has on our mood. So obviously, again, I'm not going to go with a specific dietary thing except the idea that eating healthy is going to have a lot of benefits on our health. So back to the culinary trends. Less than 60% of meals eaten at home were actually made in the home. Again, the push that we need to eat more of these meals at home. When we aren't making these foods at home, we don't necessarily know what's going in them, so therefore a lot of the sodium, the extra fat, the extra salt, sugar, everything like that, it's just always going to be higher. So one thing I'm often talking about when I'm teaching people how to cook, especially teaching students, is still season your food. Use some sugar. Put a pat of butter in there. I was telling students, quit being a snob. No offense, I like local organic vegetables, but if I'm talking to a family about trying to get a meal on the table during the week, use a bag of steamable vegetables. But the important thing is, put a pat of butter on there with some salt, because otherwise it's going to taste pretty bland and they're not going to eat it again. Oh, but Dr. Skelton, why would you do that? I'm talking about a pat of butter. If they order the fried Brussels sprouts at a restaurant, I can tell you there's going to be a heck of a lot more butter on those fried Brussels sprouts in that restaurant. It's always going to be a whole lot more. Only 11% of your daily sodium intake comes from food that you cook yourself. So salt your food, season your food, put a little bit of oil, put a pat of butter on there, make that food attractive to eat at home so you will eat more meals at home. I like this quote by Michael Pollan. It's amazing of how much we will watch Food Network, but we actually won't cook those foods at home. So I'm going to speed this up. I think my time's starting to run out with you guys a little bit. So I've already talked a lot about this. I got to slim these slides up a little bit. But there's actually proof of using these things, what we call clinically, using them within a healthcare setting. That doing these with, quote, patients, real people, has actually been shown to improve physical and mental health. That doing a teaching kitchen, like we have at a local YMCA in Winston-Salem, like Kitchenology is going to do, is actually shown to improve blood pressure, it can improve weight, it can improve their cholesterol. It can make people not only improve their mental health, like I talked about, it gives them a feeling of control. Patients with heart failure, when they learn that they can actually cook at home, and actually cook in a way that's healthy and low sodium, it gives them an increased feeling of control of their disease. And there's a lot of research that's what they express. I'm like, I feel in control of my disease in my life for the first time in a long time. So curriculums that have hands-on, see one, do one, teach one, hands-on teaching classes, it gives them much greater feeling of control of their health than when they don't have those things. Cooking skills that are related to food choices. A big one showed that actually it broadens their ability to cook vegetables and the choices they have of their vegetables. Overall, on average, women in all food groups had higher cooking skills when they participate in classes like that. So there is evidence, there's growing evidence that putting people through classes, hands-on cooking classes, can improve their culinary skills, and it's been linked to improving their health. More meals at home improves their health. I've said that 8 million times. Me as a pediatrician, more meals at home has so many positive effects for children. The more meals that you have at home with your children, not only do the children eat more fruits and vegetables, more fiber, more iron, more calcium, leaner protein, they actually do better in school, less likely to use drugs and alcohol, less likely to have teenage pregnancies. All from having more meals at home. Because it does so many other things. So the more that we can encourage that. People always say, what one public health campaign would you have to address childhood obesity? And I say more meals at home. You know, not eat more fruits and vegetables, not more exercise, not less TV, more family meals at home. So I'm going to speed that up a little bit. In schools, I'm actually against doing BMIs in schools. I'm against food and nutrition interventions in schools. It tends to actually be very harmful, but what I do like, I like cooking classes in schools. There's evidence that that works. It not only can actually lead to kids eating more fruits and vegetables, it increases nutrition knowledge. School gardens, which I used to always poo-poo, it works. I had to eat my words on that. So getting kids more in tune, knowing where their food comes from, those things actually work. Grocery shopping, teach people how to make shopping lists. They're twice as likely to focus on healthy eating if you teach them how to make lists. So what my wife calls man shopping. So I'm at the grocery store, oh yeah, we need more grits. I buy grits, I go home, and there's 8 boxes of grits at home. That's man shopping. So that prevents man shopping. So learning to make your list for the week, see if you already have it, and then go to the store to buy what you need for the week. Food labels, teaching people to be wary, not only of reading food labels, but also be wary of the store advertising. Grocery stores are very good at what they do. They're very good at trying to get you to buy the thing that's at eye level. That Dora the Explorer yogurt is going to be at the kids level because they know that kid's going to grab that and beg you for it. They're very good at what they do. And one of the biggest things is helping families realize they need to make time to shop. We make time for what's important to us, and if you're getting families to cook at home more often, they actually need to make time to shop because it takes a while. Grocery stores design that on purpose. You go in first and you go to the produce. It takes a while. You're picking out and you're weighing and you're thinking, and then you start to get a little anxious. And then what do you smell? In my grocery stores, they're rotisserie chicken. And then you're impatient. They do this on purpose. You think I'm being paranoid. They do this on purpose. So then you buy, I'm just going to get this because I'm hungry, and then you hit the processed food aisle. They do that on purpose. So they're very good. So stick with your list and don't man shop if you take anything away from this. So here's, so again, this really kind of goes to how much we're spending more time out. We spend more time eating out than now we do at the grocery store. A lot of people, they're not enjoying cooking anymore. That's kind of the sad thing. People built up sort of an aversion to cooking, and they become very sort of oppositional about it. And so that's one thing, is trying to find ways that people can just go buy that rotisserie chicken, buy those steamable vegetables, as long as you're doing it home. Sometimes the first step that we do is get people to instead of getting everyone's food out and bringing it home, get one takeout meal, but we empower the parents to buy it themselves to get the kids used to not ordering out, and then get them used to eating at home, bringing that takeout and eating at home to get them used to eating at home as a first step to eventually cooking at home and eating at home. Food Network broke my heart. I learned to cook by Food Network. I learned to cook by PBS and Food Network. That's how I learned to cook. Food Network started in 1993 as a TV for people who love to cook. And within a couple years, it quickly rebranded for people who love to eat. And now it is no longer Emeril Lagasse. It's no longer these really good chefs who actually, not eating at an Emeril restaurant. I mean, he's a really good cook. It's no longer those cooks. It's celebrities, it's influencers, and people like that. Now it's entertainment. It's no longer about that. It's about competition. It's about entertainment instead of actually being about the food. So anyway, we're going to end at noon so y'all can get to your Sunday lunch. But overall, I know it's sort of all over the place. But culinary medicine is absolutely, it's a real thing, obviously, but in the healthcare field, it's a real thing. It has a clinical purpose that can be focused and used in very clinical ways to improve health. No matter what the disease, it can be used as a preventive way. It can be used for people recovering from illness. It can be used to help control diabetes. It can help raise healthy eaters. It can help with picky eaters. It can help raise kids to prevent diabetes. It can be used in so many different ways. We're using it at Wake Forest right now to help the next generation of doctors to understand food, understand the cultural aspects of food, understand food insecurity, understand it's oftentimes it's about how you eat, and it's a very personal thing, and it's more than just telling people what to do. It's about showing them how they can lead a healthier life. And we're very excited for Jonathan Ross and everything going on here, and I'm thrilled to see you guys here and supporting that. We're really looking forward to partnering with you all. So thank you all very much.
Thank you, Dr. Skelton. Our last speaker is going to be Ross Bowles. Interesting story, a beautiful coincidence is that my son, any travel, baseball, parents in here, soccer, basketball, you know how time consuming, how much time is spent with other parents. Well, it just was a nice coincidence that Ross and Johanna, their son, played baseball with my son, so we got to know them very well, and you can learn a lot about somebody from watching them cheer on their son or daughter at a sport event. So one thing, I spent a lot of money on a very high-priced graduate degree, and it was like $90,000 for a one-year MBA program. And the main thing I got out of that program, I could have saved myself a lot of money, was that you have to build a team. And Ross and Johanna and Jonathan have built an amazing team with Hadrian, Daniel, Adele, Kim, and they need to continue to build out that team to scale their effort. But teamwork is something they pride themselves in, and Ross is a key member of the team. I'll introduce Ross.
I think the recurring theme that you all hear here tonight is education. We have to educate people. We have to educate ourselves. We have to do better. It's not just food. It's not just nutrition. Everything is sliding backwards. We have to get back in the forefront of this. We're in the perfect place in the country. We're in the Carolina core. We're in the perfect place. We're equidistant from New York to Miami, Florida. You know, we're right here, East Coast Central. And we have everything at our disposal that we need to make the whole system improve, nationwide, worldwide, whatever you want it to be. I started as a chef. Came out of high school not knowing what I wanted to do. I went and trained, went to culinary school. I worked in some really fine dining hotels, restaurants, things like that. I thought that's what I wanted to do with my life. Then I had a family, and realized that I wasn't getting to spend enough time with my family. And my mother-in-law, who is a PA, as you've heard, she kept nudging me towards healthcare. She said she thought I'd have a good bedside manner, so. But life will push you where you need to be. I never thought I would be a teacher, but whether it's in cooking, nursing, whatever it is, I feel like I have an ability to reach out to people and educate. And I've known Jonathan since he was 13, 14 years old. I've watched him grow up, and he's taught me so much. I've enjoyed watching him become a man, and just this mission he's been on, he's never let up. He's been relentless. And there were times we were like, will he stick with it? But he's blown me away. Thank you. Thank you, John. Very few times in your life do you get lightning in a bottle, and I think you all see it here. We have some of the best people and resources right now. Our team, Kim, our dietitian, my wife Johanna, Daniel, our gardening director, of course Jonathan, working with some of the students from UNCG and everything like that. And then the upcoming stuff, I feel like a kid at Christmas. I really do. I get to work with Dr. Skelton. I can't wait to pick your brain. I'm coming to the farm, don't worry.
I'll put you to work.
Bitter melons, come on. So it's so exciting right now. We are affiliated with Cohab and Short Street, these two wonderful groups that are just like working with us because they see the potential of what we're trying to do. And there's just so many good aspects right now that we just all need to pitch in. Like I said, it's lightning in a bottle right now. I think there's an awakening. A lot of people are starting to see that we need to make some changes here. And we just want to be a little part of that. So, and again, I hope you all enjoyed this night. So, you all have a good night.
Do we have time for Q&A, or you guys?
7:30 is the wrap-up time.
Yeah,
So
okay.
That's good. We can make it to church.
I'll just give you guys something to think about. There's a QR code on your card. You can scan that. You can learn more. We're going to do a Q&A session right now. This is kind of a kickoff to the 2023 year, and the plan would be for the team to follow up with you based upon your interest in getting more involved with the charity through time, talent, and treasure. I learned that from my wife. She's a fundraiser for the YMCA. she's here, but I'm going to kick it off, and I'm going to donate. We've donated in-kind things as a company, and our time and the things that we do naturally. But I'm just going to do a $10,000 match. So whomever. We'll match up to $10,000 just to get things going, and that's a questions. I guess maybe you guys should come back up.
Here, I got a question.
Yeah.
My name's Christopher. I live in High Point, and thanks again for putting this together, guys. It's great. Is there any is there another event coming up that you can tell us about? This is really great.
Yeah.
we want to, I would love to do quarterly seminars like this. I mean, we're really working to build out our lunch and learns. I mean, that's, our catering with the cause, we want that to be focused more with the mission of gathering people around food, but activating our purpose. And so this is what we want, and we would love to do more of these opportunities where we can have more engagement. We don't want just to hear from us. I mean, like I said, our speakers, our people that are in the community activating these opportunities. Research is great, but research only does so much if it's not applied in a community-based way. And there's a lot of opportunities that are coming together, the pipeline with what is happening in this region. So yes, on your point of that, I would love to. And Chris, I mean, especially, I mean, I know that your family organization company does a lot in the community, and I would love to work with you and find ways to even, you know, see what your input is and how we can maybe do something around that. And, so yes, I would love to do more, and we can start working on planning the next one.
To piggyback off of that, though, we work with Carolina Core as well. They have an amazing teams room, and we've done some catering events there, but we've also participated in their networking events, and they have been incredible. I mean, we left, one day just hurrying and trying to get there. We were just there like right at time, and but it ended up being like the most inspiring, 2 hours probably that we spent. So there is a lot of like-minded individuals, and there's a lot of like-minded individuals in this room, but we're finding more and more, and we're finding that connection, and I think that we were missing during the pandemic, and I think a lot of people have come out of that, craving more community and more connection, but also just a better way of life. I mean, more people were eating at home during that time, and people are listening, people are really craving this, and so we believe in what we're doing, and we want to see it continue. So we love this, so yes, we would love to, so yeah, absolutely.
Any other questions of any kind?
For Dr. DeLeon, right? Do you share the seeds that you have, the special varieties that you have?
I can tell you where we get the seeds from.
Okay.
We don't save seeds, and all the produce, by the way, we grew, we harvest anywhere between 3,000 to 6,000 pounds a year. All donate to local charity. Soup kitchen, we have food bank truck coming to pick up, and then we have people driving cars in lines, about 4,000 individuals last year. So one thing we do not do is to save seeds for two reasons. Number one, I gotta help the seed company to make some money. They're the ones doing good. But the second thing is, a lot of these vegetable fruit, you really can't save the seeds. And that's the terminology about horticulture and all this other stuff. So anyway, I buy seeds from High Mowing, from Vermont. And then I also buy seeds from Johnny's Seeds. They're really popular and a great germination rate. But most of the authentic specialty fruit, vegetable seeds, I just buy them from Asian grocery stores. It's really simple, not that complicated.
Okay.
And don't forget the cookbook and all this other stuff.
Yes.
I'm just going to ask myself a question. I know it's probably tacky. So when we're looking at giving a grant, at least our foundation, and I know a lot of other foundations are very similar, one of the things we look at is what are the other areas of support? Who else is supporting their work, whether it's in kind or is through donation? And we don't necessarily look at the amount that is contributed. We're looking at who is supporting the work and why are they supporting it. So when you're thinking about giving to, whether it's to Kitchenology or any organization, and you ask the question, is my $5 going to even make an impact? It absolutely does, because when they are applying for grants, whether that's locally or on a national level, the support is critical. And especially, one of the questions too is, does your board support the work you're doing? And to be able to check the box that says 100% board support is very important. So I want you guys to know that if you're thinking about supporting them, whether it's with your dollars or with your time, it goes a long way for them to continue to get more funding, both locally and nationally. So I just wanted to answer my own question.
Thank you, Meg. Well said. And that's really the honest truth, is that we would rather, in all honesty, have lots of little donations. My favorite quote is, many hands make light work. Well, many hands feed many people, and that's the thing, is that, it's a more sustainable system if we get many more people giving small amounts than trying to go for large grants, that, you might not get again, in a sense. And did you have something, Heidi? I'm sorry, I didn't know there was a, Matt.
Thank you, Jonathan. I'll just say briefly for the group, many of you probably know this, I'm on the board of the Second Harvest Food Bank. There is more initiative, energy, and entrepreneurship going on in High Point maybe than anywhere else in the country. I haven't been everywhere else in the country, but I know more so than anywhere else in central North Carolina, Piedmont, Triad footprint, and be proud of not just Jonathan, but Jonathan, and so much work is being done on this idea of food security, moving from food insecurity, give a fish, to food security, teach the fish. There's a lot of great things going on, and congratulations you and more with that. My question was for Dr. Skelton. I should probably know this answer, but I don't know if pandemic's the right word about childhood obesity. How much education of a class like yours, you talked about having it in the med school, terrific, but how much is just in public schools teaching a class like this? And is there an effort or initiative or way to get more of that in our schools?
Yeah, not enough going on. And actually, we just had the School Health Alliance over to our teaching kitchen to talk about that. And so it's sporadic and not enough. I think it's on radars, but I don't think it's growing the way it should. I think it tends to be very school specific. Someone that's interested, a teacher or volunteers like that, but I don't see that there's a concerted effort on a broad scale. But I think it's on people's radars. I think it could be something in the future, but it's waiting for a spark right now.
We don't teach enough on financial management. I imagine we don't teach enough on health in our schools.
If you want to know how much time the average elementary student gets, there's on average 1,000 hours in a school's time. And they get 3.5 hours of nutritional education a year. And oftentimes that is actually about like peanut butter and jelly, and I don't mean that sarcastically. It's very basic understanding, like peanut butter gives you protein, you know? So.
Or outdated concepts that don't apply.
Right.
Yeah, I remember being in the High Point Central High School cafeteria, and I was like terrified to even be in there. Honestly, like nothing about like that place represented nutrition.
Well, and that's the other part too, is getting the meals more healthy.
Yeah.
Well, and that's the thing, I don't criticize at all the faculty, the school workers, the cafeterias. They are doing everything they can, even to the state school nutrition directors. You know, it's hard, like you're saying, to the procurement process. There are 72,000 students in Guilford County.
Well, there needs to be education, because what we hear about is, hypothetically, you can have apples at the end of the line, or put on the tray, but then they get thrown out.
Yeah. And, you know, just I guess, the action-based ending to this amazing event tonight is that that's what we're doing and where we're going and what we need, why we need this residential kitchen. I mean, the support that we're asking for is to really help us connect with further people that can help with the decision-making process and, yes, the funding opportunities. From my time working here at Holt Environments, I worked on a lot of the catalyst projects here in the Triad area, and especially in High Point, you know, the Children's Museum, the Rocker Stadium, the visitor centers. I remember being a part of the original Local Places, Local Foods grant, the USDA, when there was a decision of putting the farmers market at the library and what was going to be built around that. So it was great learning about a lot of these class projects and how this was going to be developed in and around the community. And from the point of helping with, you know, being involved with Growing High Point and Greater High Point Food Alliance, and when we hit a collapse with our, you know, resources and was ranked #1 in the nation for food insecurity in 2015, that was my call to action for all this. And being a part of the professional community, but then also being on the community level, working on the infrastructure of revitalizing our food system, I really mean it when I do 100% believe that what CoHab is doing and what Short Street is assisting in that process and developing out the space in and around that area and how it's near Common Yards, this is the next catalyst project. And it's a part of the activation and what I do believe that there's a decision process about a commercial kitchen in High Point. And I really want to bring along the community in that conversation. And I really think that this is the next activity of what this space can be. This building space right here is able to be a teaching kitchen where schools, as you're saying, Chris, that they can have the opportunity to do field trips here, bring them in and teach them. I mean, that was what we were limited in our current space. We don't have the means to do that, but there's so much more activating in and around the space and in this area. And I really think that the best strategic process of this is to, really, like when I say we learned a lot in our discovery phase this last year, there is so many more obstacles, and not saying negatively, but with the health department and other means, that if you do not go through this process, you do not understand the barriers. And so I just really believe that with the support of everybody in this room tonight, we can activate this next phase that then will activate the next Catalyst project with the kitchen that I really do feel in High Point will be a national food investment model. I mean, we can really go from 2015, #1 in the nation food insecurity, and then this last year, this was the first time that the White House administration revised the nutritional standards in 50 years. And their goal is to help improve dietary means and exercise because they realize how much chronic disease is happening. And they have a goal by 2030, and I guarantee you we can make that goal with High Point and help lead the way, but it's really a part of your guys' part in that. It's not really us. We're doing what we can do, but it's with your support that we can actually make this happen for our community.
And to piggyback off of that just a little bit, we would really love to set up a time to show you guys the space and to be able to take you down there and actually see it and see what the vision is and to feel the vision and to see and fully understand what it is that we're trying to build out to activate in this space. So if you guys would like to see that, I mean, please let us know. The Short Street
next
team.
party?
Okay.
So I just wanted to congratulate you and your team. Amazing job. I'm with Collins School of Health Sciences at High Point University. And we're looking forward to partnering and learning alongside what you're doing. It's amazing for the community. But I wanted to highlight just one new thing that we're creating in the school. It's a Bachelor of Arts in Health and Wellness that starts brand new in the fall. And so that'd be a great way to partner our students. It's based on the pillars of lifestyle medicine. And so a great opportunity on the ground to kind of work together. And then the second point is, of course, our pro bono clinic, physical therapy care for those that are underinsured. We recognized right away that food insecurity was a major part of treating holistically. And we've created a community garden with a food bank. And so those things all work together, and we're super excited to work with you as well. So thank you.
Can't thank you enough for sharing that, Dr. Ford. It's such
If I can have one quick minute, I would also like to congratulate Jonathan and his team. On behalf of the City of High Point, myself and Caitlin Gerald, we're here representing the OB Recreation Center from the City of High Point. Jonathan has partnered with us for a couple years, as some of the slides that you can see right over there on the screen for the OB Community Garden. Jonathan has come out, he's worked with our after-school kids, our summer camp program, so we're extending it past the school day within the school systems. So Jonathan has reached out to the OB Recreation Center, and he's come and did some wonderful teaching experiments and did some things with the kids there, hands-on. He's taught them, ways of how to set their plate, what they're supposed to have on their plate that looks like a good meal. So Jonathan, we will extend our gratitude to you, and we want to continue partnering with you, and we look forward to being able to come to that teaching kitchen.
Thanks, my name's Kim. I'm the dietitian for Kitchenology. Kitchenology did not recruit me. I actually approached them. I work in an outpatient setting, so I sit with veterans for an hour, at least an hour, going over everything that has to do with their nutrition and health. But I started to notice a big gap. So I can teach you how to cook. I can teach you how to manage your diabetes, hypertension, whatever nutrition-related disease you have. But if you can't go home and actually cook the food and implement what I'm teaching, it's worthless. It's a waste of time. So I went out looking in the community to try to find out how I could make a difference outside of my work because they are just very much, this is medical, stay in your lane. And I'm like, Roger, okay. So I went out in the community and I found Kitchenology, and they answered all of my prayers. I can teach my nutrition education, I can teach them how to cook, I can send them home with a box of vegetables. This is how we really make the difference. I can talk all day long, and it doesn't do any good if they don't have the food. So Kitchenology is a dream come true for me. It warms my dietitian heart. When I met Jonathan, I was like, yes, I will follow you on this nutrition path anywhere it goes. So if you really want to make a difference in the community, this is it. I'm very proud to be part of this team, and just thought it was important to note that I found Kitchenology. Kitchenology did not find me, and they've already made my career dreams come true.
Will you all be presenting, would you willing to come present at the city council meeting at some point?
Certainly, I would greatly appreciate that. Thank you. Yeah. That would be such an honor. I would really appreciate it.
I have a question.
Yes,
or
please.
maybe a request. Can you explain to everybody in the audience about your meal prep services? For those of you who may not want to cook, can you explain what that consists of?
Thank you so much. So this is why we need your support, is because we are scaling and we're trying to develop our programs that can go beyond just the teaching part of it. And like you heard from Dr. Skelton, is that the difference of what this is going to change in healthcare is if people increase their home meal consumption, right? And we know that by 1 week, one class a week for 6 weeks is not going to do that. I'm not going to lie to you, right? And so our goal is to be able to allow those families or participants to come into having a program with us. That's the part of the initial process of it, right? Hands-on cooking classes, learn how to meal prep or, make the meal themselves. But the goal is that for us to be able to have a meal prep program that we can be able to, even if you're affluent or have, need to have the means of utilizing other EBT resources or so in that sense, that there could be a means of a meal that you can purchase that we can actually, make it for them to have 2 or 3 or more meals that they can eat at home. And that's what's going to change the difference, because even if they have those meals that we already are pre-making for them, or if they're even cut up to the making of that for them, that it makes it easier for them to make at home. And then they're taking that 1 course class with us each week. They're going to increase how many meals they eat at home, and that's going to increase how many meals they make at home. And so with what Lisa and Short Street are allowing us to do, because even this is what we were saying about the health department, we couldn't do that in our own kitchen. Like, we have a commercial kitchen, and we found out that we couldn't sell product, make product and sell it or put it out in other places because we weren't a USDA or Department of Ag kitchen. We were only a health department kitchen, and their facility is all of that. So with them working and allowing us and working with them, we're going to be working to hopefully make it where we can get culinary students from DTCC and other healthcare students from other, train them up, just like Hadrian. Hadrian is a prime example. I cannot speak enough of Hadrian. I'm telling you, he has stepped up, come in, has worked the kitchen, worked alongside Ross, and has done our caterings and stuff like that. But he's also getting the training and experience, and we want to be able to feed that forward to him and the paying opportunities. So that's the model of the Feed It Forward. The food education forward is like when you work to buy a meal from us, when you actually purchase our catering opportunities, doing these events, it's educational based, it's learning, but it's actually feeding the program. It's actually going to feed the opportunity to make these meals that will actually create, what Mike was saying, with the graphic design side of things and the marketing, you spoke on all that. Like, I go around talking about how much marketing is, and it's criminal. I will say it, 100%, especially the food industry. It's really sad. I had a whole thing about my nutrition class about this, is that we were talking about the epidemic of chronic disease in our country, and the food industries that cause the same issue. When the World Health Organization determined it as a health disparity and issues, the same food industries were able to profit even more because they made diet culture, okay, health culture. And so they know what they're doing. And what we're trying to do is use those same strategies of marketing, but in a way that is actually integrity, coming from the local farmers, showing you how, like, you know, a local economy with that, sourcing it from local food, getting into our community and training our people, we can actually sustain this and actually create long-lasting impact. And so, yeah, thank you, Lisa. So yes, that's what we're scaling to, but this is why we're asking for your support. So if you actually look on your badges, like, and not to say that, but I was so thankful for Mike kicking this off and your generosity. I'm not going to get emotional again, but is that we have a $325,000 amount that we are asking and raising for. And when you look at that on the massive amount of, we spend upwards of $50 billion annually in healthcare issues. What we're asking for is so small. It is so small. And that's to be able to get us to be able to develop the next level of what we're doing for the next year, activate the space, bringing in the professionals and the partnerships that we have, and we're going to do it together. So I appreciate all your help.
Awesome.
So enjoy